For more than a century, Western Tidewater in southeastern Virginia and Gates County, North Carolina, have benefited from one man's generosity. And today his legacy continues to provide health care to the people of the region, especially those who cannot afford it on their own. The seeds of Amadeo Obici's success and philanthropy took root in 1889 when he arrived in America, unable to speak English and with less than $1 in his pocket.
Amadeo Obici has turned out to be a wonderful citizen of Suffolk and has done much for us, but he came from Italy as an 11-year-old boy because his parents sent him to America to live with his uncle in Scranton, Pennsylvania, because they thought the opportunities in America would be much greater for him.
Hard work and ingenuity at his uncle's fruit stand paid off for young Obici.
He noticed that peanuts sold well in his uncle's business, and so he decided he would expand it a little bit and be a little bit more aggressive in marketing, and he built a homemade cart, push cart, and pushed it around Scranton, Pennsylvania, selling hot roasted peanuts. And this did so well that he started expanding on that.
In 1897, Obici teamed with another Italian immigrant, Mario Peruzzi, in Wilkes-Barre, Pennsylvania, and together they founded Planters Peanuts in 1906. 7 years later, in order to be closer to his peanut supply, Obici built a new processing plant in Suffolk, Virginia, then the world's largest peanut market.
When he came here, he was the first with many things in his factory, the cellophane bag, they call it the 5-cent bag of Planters peanuts. And he was wanting to develop his own logo and identification. And he, in 1916, had a contest in the schools for the kids to present a logo to him. And a little boy who was, I understand, about 13 years old, came up with some drawings of what he considered Mr. Peanut. And Mr. Obici liked it, and he added a couple of little twists to it, like a top hat and that type of thing. But essentially that was the start of Mr. Peanut.
In 1924, Amadeo and Louise Obici purchased Bay Point Farm in Suffolk, nearly 300 acres on the Nansemond River, today the home of Sleepy Hole Golf Course, where the Obici house still stands.
Well, I thought it was interesting when he built his home down on the Nansemond River. He had a stairway going up to the second floor, and the stair rail, was built to accommodate a man who was 5 feet 3 inches tall. So now when we go and use that, we say, why is this so low? Well, it's Mr. Obici. He was a little big man. Mr. Obici, having come from Italy to seek a better opportunity and having enjoyed that opportunity, become a very successful business person, was married but did not have any children. He had scads of other relatives, but he became interested in the people in the area that he moved into.
Louise Obici died in 1938, and Mr. Obici decided to leave the bulk of his estate to build a hospital in memory of his wife.
Stick out your tongue. Stick out. No.
And I think he was very conscious of the fact that there were a lot of people around Suffolk that did not have a great deal of money. They were downright poor. And he was concerned about how to help them, and health care was a way to do that, providing health care.
In 1947, Amadeo Obici died. 4 years later, the first Louise Obici Memorial Hospital opened.
My father was one of the original board members, and I think was very pleased to be, and I know he worked hard for it. I remember he always made a big point about what a wonderful thing Mr. Obici had done for the people of Suffolk in leaving the hospital debt-free.
I went on the board in 1966 and was on for a number of years, really 40 years.
For more than 30 years after the hospital opened in 1951, Proceeds from the trust funded new equipment and building expenses. In 1985, the Obici Foundation was established as a subsidiary of the Obici Health System. George Birdsong was its first chairman.
From 1985 on, I worked very closely with Sam, who was chairman of the board of the hospital, the operating board, and I was chairman of this group that was holding some of the funds that was dedicated for the future. And so we agreed that we would use some of these funds that we in the Obici Foundation were holding to help the hospital out as needed before they got to a real big project like building a new hospital.
There are always changes in every part of life, and there are certainly changes in the life of the Louise Obici Memorial Hospital. It was built at a time when central air conditioning was not really felt necessary. Later on, it was felt necessary, and of course had to go back and retrofit the hospital to cover that. Additions were made along the way as new services were provided. And as we moved along and thought about what was going on, things were added in ways that was the only place you could put it, but it was still not very efficient. And we felt that there was a need for some modernization of the hospital.
In the late 1990s, the hospital decided that rather than add on again, it was time to build a new Obici hospital.
I got another call, but this time it wasn't for $100,000, it was for, what was it, Sam? 30 million.
Fortunately, by that time, the Obici Foundation had grown to about $60 million. The board at the hospital arm of this operation, asked the foundation for $30 million towards the construction of the new hospital, and the rest of that cost was financed through the sale of bonds.
In 2002, the new Louise Obici Memorial Hospital opened in Suffolk.
The people in Suffolk, as well as the board of the hospital, were enormously proud of this hospital, which had been given by Mr. Obici. The primary concern, though, was what is the long-range situation about providing quality health care to the people in this area. And even though we had built the new hospital, we were increasingly aware of the fact that a small independent hospital simply could not make it on its own.
In the best interest of the community's future healthcare needs, the board sold the hospital to Centera Health System.
It ended up about a net $70 million that the hospital got for it, and we had 30. And so then the discussion was what to do with that from their standpoint and our standpoint, and the conclusion was putting all the money together into the new Obici Healthcare Foundation and use it for community healthcare purposes.
A number of these legacy foundations like this one have become community foundations, and they can use their funds for any charitable purpose. On the board, we felt that we really wanted to carry out what Mr. Obici talked about. We felt that he would have made the decision we made in selling the hospital, because after all, he was a good businessman. But we wanted to follow through on what his primary concern was, and that was health care for the poor. One of the things that a foundation of this type has to deal with is how to really carry out its mission. The mission really is to improve the status of health care in the area, the level of health. It's a difficult task. It's very complex. We found that the easiest thing to do is to give away money. The hardest thing to do is to give it away in such a way that it has some real impact.
Obici Healthcare Foundation's impact in the service area has indeed been significant. Since 2006, the foundation has provided grants totaling an average of $4.5 million every year. This support targets community healthcare needs, including providing access to healthcare, creating healthy spaces and healthy behaviors, and disease management and prevention.
One of the first ones we got involved in heavily was the Western Tidewater Free Clinic. And about this time they were struggling to start, and they were actually started, but they were struggling, really didn't have a decent place to provide their services. And so they came to us, and our Obici Healthcare Board agreed that that purpose was in line with our mission. And so we were very instrumental in helping them initially with about $1.5 million to buy a building, and another $300,000 for some other things. And anyway, after several years, it was probably $2.5 million. And then ever since, we've helped them with their operating funds.
Obici Healthcare Foundation, with its funding, has enabled us to grow and add services over the years. We started just a small 2-evening-a-week medical clinic, and now we are a comprehensive 5-day-a-week clinic. We even provide evening hours on Tuesday evenings because we have 37 or 38% of our patient population are the working poor, and sometimes it's the only time they have to come and get health care is in the evening hours, and that's what we try to do. We want to take broken people, put them back together, and make them productive members of our community.
It is an enormous responsibility to be a part of a group that's handling a foundation of $100 million plus and having the opportunity, as few communities do, to make a real positive impact on something as important as health care.
It's not any one of the individuals' money, it's Mr. Obici's money, and we are put in that fiduciary responsibility. And I think that certainly the joys that come when you get an accolade from some organization that you've helped, that feels good, but you've got to balance that with what are your responsibilities to make sure you can continue to do it and that you do it in a good way. And that is a reward in itself if you can do it successfully.
The number one quality I think that folks ought to have is humility. It's easy to be around $100 million and think you're hot stuff, but it takes some humility to say, how can we really use this to help people? They also need to see the grantees as partners, to not see them as folks we're simply doling out money to because we are nice people. They are full-fledged partners in this effort to improve the status of health care in our area.
There's always going to be needs for health care financing and help. Always be those indigent and so forth that will need it. And so I see no reason that it shouldn't continue in perpetuity.
One of the neat things is that there is a continuing group willing to serve on the board of the Obici Healthcare Foundation. People who are smart, who are dedicated, who want to do the right thing and are willing to work to get it done. And I feel good about the future of the foundation. I feel good about the future of delivery of health care in our area.